call. Hi, my name's Mia. I'm your nurse today, okay?
Alright.
Today we're going to be doing a physical assessment. I'm just going to start by closing this so we have some more privacy.
Okay.
Alright, I'm going to now verbalize that I'm washing my hands.
Mm-hmm.
Okay? Like I said, today we're going to be doing a physical assessment, so I'm going to start off by checking your two identifiers.
Mm-hmm.
So I'm going to check your wristband. Can you tell me your first and last name?
Savannah Grissom,
And can you tell me your birthday?
March 17th, 2005.
Okay, Miss Grissom. So now I'm just going to start by asking you some questions. Can you tell me your middle name?
Grace.
Okay, and can you tell me where you are today?
I am in the sunshine
And can you tell me why you're here
to film checkouts.
and what month it is?
It is September.
Okay, my patient is alert, awake, and oriented ×4. So now that we've done that, I'm going to just let you know that this is confidential and you have the right to refuse anything you do today, okay?
Thank you.
Okay, yeah. So starting off, I'm just going to look at your eyes. Okay. Your eyes are symmetrical and your sclera is white. Okay, so now I'm going to use my pen and I'm just going to measure your eyes, okay? Okay, your pupils are a 5 right now, bilateral. So now that I've done that and I've examined your eye shape and your size, now I'm going to shine my light in it, okay?
Okay.
Okay, your left eye is reacting to light, as is your right eye, so both eyes did react to that light, okay? Now I'm going to test your eyes for accommodation. I just want you to look at my pen and I'm going to bring it closer to your face and it's going to test for that accommodation. Okay, so both eyes are round. They did constrict upon light, so they were reactive and they were equal and they tested positive for accommodation, so correlate was there. So now that I've inspected your eyes and we're done with the eyes, I'm now going to move on to your ears. Okay. So I'm just going to start by looking at your ears. Okay. I don't note any ear piercings. Your ears are symmetrical and they are aligned with your outer canthus. And when I was looking at your ears, I did not note any redness or discoloration on either of them. Okay, so now I'm going to just look at your nose. Okay, your nose is symmetrical. It's proportionate for your face. And I don't note any running of the nose. So now I'm just going to ask you to look up like me. I'm going to look in your nose with my pen light. Okay, your nares are pink and moist, and your turbinates are present. Okay, so now that we've looked at your nose and ears and eyes, I'm going to do your mouth, okay? Now I'm just going to look at just your lips. They're moist, they're not chapped, or no dryness, one solid color. So I'm going to ask you to just smile for me. Okay. Your teeth are, they're white, they're clean. I don't note any caries on your teeth. So I'm looking at your gums right now. Again, it's pink and moist, and I don't note any bleeding or gingivitis. So I'm going to ask you to open your mouth. I'm going to look inside your buccal mucosa. Okay, I'm not seeing any ulcers. It's pink and moist in there. So now I'm going to ask you to put your tongue on the top of your mouth, and I'm going to look at the floor of your mouth. Okay, your frenulum is intact, and it was pink and moist, and I didn't see any lesions. So we're going to do the same thing, but for the roof of your mouth. So just keep that tongue on the floor. Okay, again, I didn't note any lesions, and it was pink and moist. So now that we've done that, I want you to stick your tongue out for me, and I'm going to look to see if your tongue is pink and midline. Okay, your tongue is pink and midline, so now I want you to stick your tongue out a little bit further and say ah. Okay, thank you. When doing that, I did look at your uvula, and it did rise upon phonation. I also graded your tonsils as a 0. Did you have a tonsillectomy?
I did.
Okay. And again, the back of the throat was pink and moist. I didn't note any redness or discoloration there. Okay. Now I'm going to ask you to come with me, and we're going to do the Snellen chart, okay? As you walk to this chart, I'm just going to be observing your gait. Okay, you can stand right there. That's going to be 20 feet away. And can you read the lowest line you can for me with both eyes? Okay. Visual acuity for both eyes is 20/20. Now I want you to cover your right eye and read it with your left eye.
D-E-F-E-O-T.
Okay, so your left eye is 20/20 vision. Now I want you to cover your right eye and read the same line.
DEFPOTEC.
Okay, so your right eye is 20/20 vision as well. Okay, so we're gonna go back to this room, but before you sit down, I'm gonna examine your spine. So if you just want to stand by that bed for me. And when I was observing your gait earlier and when you were walking into the room, it was steady and it's coordinated. Okay, and normal. So I do want to test some range of motion with your back. I want you to bend forward for me. Okay, and can you bend backward? Okay, good. And can you bend on both sides with your back? Okay, so you do have full range of motion for your back. I'm going to close this again, I'm sorry. Okay, so while you're standing, I am going to test your back for scoliosis, so you don't have to get up too much. So you can bend for me. Okay, I'm going to feel your back. I'm also inspecting to see if I see any disalignment with the back. So your shoulders are symmetrical, you can stand up. And so are your hips, and your spine is midline, it's normal, and it's negative for scoliosis. So you can sit back down for me. Okay, and we were on the mouth, so can I test your gag reflex?
Not today.
Okay, so my patient did defer their gag reflex, but if I was to do that, I would use a tongue depressor. I'd ask you to stick your tongue out, and I'd put that in the back of your throat, and you gag, and that would test your cranial nerves 9 and 10. Okay. So now I'm just going to start by inspecting your neck. Okay, upon looking at your neck, I don't note any discoloration. The color of your neck is appropriate for ethnicity, and I don't see any lesions like moles or anything like that. So I'm now going to look at your pulsations with my pen light. Okay. Okay, I don't see any pulsations on that left side of the neck. Okay, and I don't see any pulsations on the right side of that neck as well. So now I'm going to palpate your carotid arteries one at a time so we don't block out blood flow. I'm going to start with your left side. Okay, I'm going to grade your left carotid artery a 2+. I did not feel any thrills. I'm going to do the same for your right. Okay, again, I'm going to grade that a 2+, and I did not feel any thrills. So now that I've palpated and inspected, I'm going to listen for buoys, okay? So I'm going to use the bell of my stethoscope, and once I put this bell on you, I want you to hold your breath for me, okay? Just going to listen for any swooshing. Okay, I'm going to start with that left side. Okay, no buoys are present in that left side. I'm going to do the same for the other. Okay, again, no buoys present in the neck, okay? Okay, now that we've done all parts of the neck, I'm going to move on to your posterior chest. So if you want, I'm just going to get behind you, if that's okay. Okay, and I'm just going to start by inspecting your posterior chest, okay? Upon looking at it, your shoulders are symmetrical. I don't note any discoloration in the posterior chest. I don't see any lesions bilaterally, so, and the skin color is appropriate for ethnicity. So now that I've looked at it and I've stated that your shoulders are symmetrical, I'm going to palpate your back, and I want you to tell me if you feel any tenderness when I do this, okay? Any tenderness? Okay. Again, any tenderness? Okay. So patient notes no tenderness on any part of the palpation. So now I'm just going to start by listening to your breath sounds, okay? I'm going to do a lot of different sites on this, but I just want you to take deep breaths in whenever I put my stethoscope on you, and I'm using the diaphragm for this part. Okay. Breathe in. Okay. Again. Okay, breathing sounds were clear bilateral. Again. Okay, I do realize this, let's take this off. This gown is a little in the way. Is it okay if I unbutton it?
Yes, it is.
Okay, I'm going to do those last two we just did again, alright? Okay. And I am doing this in a ladder method. Okay, breathing was clear and bilateral. breathing was clear and equal bilateral in all parts of the posterior chest. I didn't hear any wheezing or bronchi when I was listening, no crackles, so it all sounded good. So now that I've auscultated, I'm now going to feel your CPA or costovertebral arch, and I'm gonna feel for any tenderness in there, okay? I'm gonna do this by holding my hand on your back, and then I'm gonna hit it with the ulnar side of my fist. Okay? I'm gonna do this in 3 spots. Did you feel any tenderness during that?
I did not.
No? Okay. Okay. And that was testing for your kidneys. I'm gonna button your gown down. Okay, I'm gonna get back in the front of you, okay? Sorry. I'm actually gonna unbutton your gown now. Is
No,
that
that's
okay?
okay, yes.
I need to inspect your
Yes, of
interior
course.
chest. Okay, so we did the breath sounds on the back, so now we're just gonna do the same thing in the front. Thank you. Okay. So just looking upon your chest, I'm now looking at your breathing. Your chest is rising and falling symmetrically. Now I'm going to count your respirations, okay? I'm going to do this for 30 seconds and multiply it by 2. Okay, your respirations are at 16 per minute. So now that I've looked at your respirations, I've looked at your breathing, which is unlabored, even and steady, symmetrical breathing. I'm now going to inspect your skin. I don't note any discoloration. It is evenly colored, appropriate for ethnicity. I don't see any bruising on your chest. I don't see any lesions on your chest as well. So now that I've looked, I'm going to just touch the top of your chest and you let me know if any of it feels any tenderness, okay? Any tenderness? Okay. So now that I've palpated, I'm going to start listening to your lung sounds just like we did the back. Okay. We're going to do this again the same way with that Latin method. Okay. Big breath in. Okay, that was equal and bilateral, no crackles. Okay, breathing was clear and bilateral. Okay, now I'm going to do a little more on your side, but that was clear and bilateral as well, okay? Okay, and that other side. Was clear and bilateral again, just like the back. I didn't hear any wheezing or crackling sounds. So all your breathing sounds were good. So now that we've listened to that, I'm going to do your heart as well, okay? Okay. There's going to be 4 spots of your heart I'm listening to. I'm going to start with my diaphragm, and then I'm going to move on to the bell to listen for murmurs. Okay, I'm going to start with your aortic valve. Okay, S1 and S2 are heard, and I did not hear any murmurs. Now I'm going to do your pulmonic. Okay, S1 and S2 heard, no murmurs present. Now your tricuspid. Okay, S1 and S2 heard, no murmurs are present. Now I'm going to do that your aortic, just down here, okay? Okay, S1 and S2 heard, no murmurs present. When I am on that, your mitral valve, I'm going to listen for your, I'm going to count your apical pulse. That's also there, okay? I'm going to do that by counting for 1 full minute. Okay. upon listening for a minute, your apical pulse was 60 beats per minute. And now while we are there, I'm also going to palpate and just see if I can feel like this. Okay. Okay, I do feel your pulse, and it is 2+ is what I'm rating it. Okay. Okay, like I said, we're gonna do the opposite order, just with that the bell stethoscope for that low frequency murmurs. Then starting with that neutral. Okay, S1 and S2 are heard, and I did not hear any murmurs. Okay, your tricuspid. S1 and S2 heard, no murmurs present. Your pulmonic. Okay, again, S1 and S2 heard, no murmurs. And that aortic. Okay, S1 and S2 were heard in all parts of your heart, and I did not hear any murmurs in any of them. Okay, so now that we've done the heart and I've listened to your apical pulse, I'm gonna now feel for your brachial pulse, okay? If I can have your wrists, I'm gonna palpate them bilaterally. Okay, I do feel them, and I'm grading them a 2+. Okay, so now I'm gonna move on to your brachial pulses. Just keep your arms where they are. Okay, I do feel them as well, so I'm going to grade that a 2+2, okay? Okay, we've graded those pulses, so now I'm going to have you do some range of motion in your upper extremities, but I'm going to start off with a strength test, okay? So I want you to hold my hand, and I want you to squeeze it. Okay, patient has 5 out of 5 strength in their hand, so bilateral. So now I want you to push against my hands, okay? That was testing for your arm strength, and patient had 5 out of 5 bilateral for their arm strength. And now we're going to do the same thing, 5 out of 5, but I want to test your shoulders, okay? So I want you to push up against me. I'm going to meet you with some resistance. Okay, patient had 5 out of 5 strength in your shoulders. Now we're going to do range of motion. So I want you to, we're going to start with your fingers and then go up, okay? So I want you to spread your fingers apart. Okay, can you make a fist for me? And can you make a 4? Okay, so you have full range of motion in your fingers, so now we're going to move on to your wrists. Can you circle your wrists just like me? Okay, can you put your wrists out like this? And can you put them inward? Okay, patient has full range of motion in their wrists. Now we're going to test those elbows, okay? I want you to flex just like I am. Okay, patient has full range of motion bilateral in their elbows. Now we're going to do your shoulders, okay? So I want you to shrug your shoulders. I want you to put your shoulders down. And I want you to roll your shoulders for me. Okay, patient has full range of motion in their shoulders bilateral. Okay, so now that we've done that, it's time to move on to your abdomen. So if it's okay with you, if you can lie down flat for me. Okay, I'm just going to cover you up with this to provide a little more privacy, okay? Thank you. Yeah. Okay, so starting off, okay? Yeah. Starting off, I'm just gonna look at your abdomen. I'm now just looking for any discoloration. Okay, your abdomen is symmetric. I don't note any discoloration. It's an appropriate color for your ethnicity. I'm looking at your umbilicus now, and I don't note any flaking of the skin or piercings there. I'm gonna look at your abdominal contour, and it is flat. Okay, so now I'm going to look. I'm gonna look for pulsations. Okay. I don't see any pulsations. Now I'm gonna use my pen light just to be sure. Okay. Again, I don't see any pulsations in the abdomen. So I'm going to start off by auscultating. Okay. And when I do this, I'm going to start off in your right lower quadrant and go clockwise. And I'm just listening to these vowel sounds with my diaphragm. Okay, your vowel sounds in your right lower quadrant are normal active. I'm going to do your right upper. Okay, same thing, a normal active. Now I'm going to do your left upper. Okay, your left upper is normal active and your left lower. Okay, that quadrant was normal active as well, your left lower. Okay, so all of your abdominal quadrants, your bell sounds were normal active. So now that I've auscultated, I'm going to move on to palpating your abdomen. I'm going to start off with light palpations. I'm going to do this in a circular motion, and these are only going to be like 1 centimeter deep. Alright, starting with your right lower. Okay, I'm not feeling any masses or distension. Do you feel any tenderness?
No.
Okay, I'm going to do it with your top, or your right upper. Again, circular motions. Any tenderness or pain?
No.
Okay. How about here?
Nope.
And your left lower.
Mm-mm.
Okay, so patient noted no tenderness in any parts, any quadrants of the abdomen. There was no distension. I didn't feel any masses, and there was no guarding the abdomen. So I'm going to do the same order of palpations, but I'm going to do it deep. So it's going to be 5 to 8 centimeters. Okay. Again, tell me if you feel any pain. Any pain?
Mm-mm.
Any pain or tenderness?
Not at all.
Okay, again, I did not feel any masses. I didn't notice any distension or guarding of the abdomen when I was palpating. So, okay, we've done your upper extremities. We've done all of your face and neck. And we've just finished your abdomen. So, can I check your femoral pulse?
That's fine.
Okay, so my patient did defer the femoral pulse, but if I was to do it, I would put my fingers on their femoral pulse and I would grade that. Okay, so moving on, now we're going to cover you back up
Okay.
on your upper extremities, just for some more privacy.
Thank you.
Yes, okay, so now I'm going to look at your legs.
Okay.
Okay. Okay, so just looking at your legs, they are the same size, they're symmetric. I don't note any discoloration on the legs. They're both an appropriate color for ethnicity. Your hair distribution is equal and it's distributed. Again, I don't note any lesions. I'm now going to feel your leg just to feel that temperature, okay? Okay, and it is equal to how the rest of the body felt. It's warm. Okay, so now I'm going to put my gloves on, okay?
Mm-hmm.
Also, I did want to show, I totally forgot this was here. This has nothing on it. This is just a note card that I thought I was going to use. Sorry.
It's
Always
okay.
a struggle to put gloves on. Okay. Is it okay if I take your shoes off?
It is.
Or would you like to take them?
Here, I can take them off.
Okay.
Thank you.
It's okay. Okay, I know we were about to look at your feet, but as you were taking your shoes off, I did remember that we did not do capillary refill in your hands.
Okay.
So I'm going to do that right now if that's okay.
Of course.
Okay. It ideally should be under 2 seconds for each one. Okay. This is me starting with your left hand. Okay. And all fingers did have a less than 2 second capillary refill. Okay, and as did your right hand, so all fingers do have that under 10 capillary refill. So I'm just going to start by inspecting the tops of your feet. They are the same color as your legs, so it's an appropriate color for ethnicity. I don't know any redness or dryness on the tops of your feet. I'm going to look at the bottoms of your feet. Okay, they look soft. They don't look overly dry or calloused. And again, they are an appropriate color for your ethnicity. I don't see any redness. So now I'm going to look in between your toes if that's okay with you, okay?
Okay.
Yeah, I'm going to start with your left foot, just looking to see if I note any redness. Sorry, I bet this is a little ticklish.
It's okay.
Now I'm gonna do, I did not note any redness or irritation between your left toes. So now I'm gonna do the same with your right. Okay. Is your pinky toe okay?
I dropped something on it.
Okay.
And it bled a little bit, but it is okay now.
Okay, good. Okay.
Thank you
well,
for asking.
You're welcome. I didn't notice any redness between your toes of your right foot. And there was no like grating of the toes to irritate it, okay? Okay, so now that I've looked at your feet, I'm gonna start by, I'm gonna do your capillary refill, just like I did for the hands, okay? So, less than 2 seconds. Okay, and just because you did just have an injury to your right pinky toe, I'm not gonna test you. But
Thank you.
all other toes, they did have a less than 2 second capillary refill.
Thank you.
Okay, so now that we've looked at your feet, we've looked at your head, your legs, we've looked at the hair distribution, the color of them, and just for edema, okay? So I'm gonna do this by using my thumbs and I'm gonna press down. Okay, there was no edema. Now I'm gonna do the other one. Okay, there was no edema as well, but if there was, I would rate it. So now I'm gonna test the strength. So I'm gonna start with your feet. Can you press up against my, sorry, let's do it together. Can you press up against my hands? Okay, good. And can you push against mine? Okay, so patient has full range of motion in their feet. And now I'm just gonna, sorry, let's do it again. Can you push down against mine? And can you push up? Okay, patient has full strength in their feet, 5 out of 5 bilateral. So now I want you to, I'm gonna put my hands under your legs and I just want you to press down, okay? Okay, can you press down? Okay. Now I want you to, you can do this one at a time, so it's not as strenuous, okay? You push up against me, okay? And we're gonna do the other side. Okay, so patient has full strength, 5 out of 5 on their legs. So now that we've done the strength test, I'm gonna start range of motion, okay? So we're just gonna start and go all the way up. So can you spread your toes apart for me? Okay, and can you crunch them up? Okay, so patient has full range of motion of their toes. Now we're gonna do your ankles. Can you flex them up for me? Okay, and can you flex them down? Okay, patient has full range of motion in their ankles. Now we're gonna do your knees. So I want you to put one knee up, just like I am. Okay, and you have to do the other knee for me as well. Okay, patient has full range of motion in their knees. Now we're gonna look at your hips, okay? I want you, since you are lying down, you can just bring your leg towards me. Yes, good, okay. And your other leg. Okay, patient has full range of motion in their hips. Okay, I'm going to feel your pulses now. So I'm going to start off by feeling your your popliteal pulse. That's going to be in your knee. So if you want to lift your legs just a little bit like that. Thank you. Okay. I do feel both of your pulses, and they're a 2+ bilateral in your popliteal region. So now I'm going to feel your tibial pulse. It's going to be on the. Okay, and that is a 2+ bilateral as well. Now I'm going to feel your dorsalis pedis pulse, which is going to be on the top of your foot. Okay, I do feel that as well. So that's going to be a 2+ bilateral, okay? Felt all pulsations. I inspected your legs and feet. We did capillary refill, range of motion, and the strength exercises. So, and we've already done your spine test. So, I appreciate you letting me do my exam on you, okay? Of course. Thank you. Okay, thank you. I'm gonna wash my hands, leave the room.